Hi, this is Colleen. I know we've been talking about different kind of cancers, how cancers are formed. Now we're going to be talking about how do we treat these cancers. There's several ways, and one of the ways is through chemotherapy. The objectives for this session are to state three reasons why chemotherapy would be administered, define chemotherapy terms such as adjuvant, neoadjuvant, induction, consolidation, maintenance, first line chemo, second line chemo, and palliative. Explain how chemotherapy works on cells and list three chemotherapy types. So, what is chemotherapy used for? It's to cure cancer, control the tumor growth, shrink tumors prior to surgeries or radiation, relieve symptoms such as palliative, and destroy microscopic cancerous cells. So I put a little picture in there. You can see the chemotherapy, the cancer cell, sorry. And what happens to the cancer cell through chemotherapy is it could stop cell division, it can cause spontaneous death, or it can create non-dividing cells. So here are some of the chemotherapy terms that you may hear. Adjuvant and neoadjuvant are usually terms that are used for patients that have cancers with tumors, such as breast cancer, lung cancer, GI. Adjuvant chemotherapy is used to destroy leftover cancer cells. For instance, if a woman or man has breast cancer and they get a mastectomy, and the provider's concerned that there might still be leftover cancer cells, they'll receive adjuvant chemotherapy. Then there's neoadjuvant chemotherapy. This is administered prior to surgery or radiation. This is to help shrink the tumor. So if a patient has a really big tumor, they want to shrink that up a little bit. So during the surgery, they don't have to they can minimize the amount of area that they need to do the surgery on. Induction, consolidation, and maintenance. These are usually terms that are used for the blood cancers, such as leukemia and lymphoma. Induction is to induce a remission. Consolidation is administered once remission is achieved, but they want to continue a remission. And maintenance is to help prolong remission. These are usually used for ALL and PML. First line treatment you may hear, this is considered the standard therapy. This is through evidence-based practices and studies that they research that this is the finest chemotherapy that will help with a specific cancer. If that does not work and the patient relapses, they'll do a second line treatment. As I stated before, if the first line treatment does not work, they'll use the second line treatment. And then there's palliative. This is administered for symptom management. For instance, if a patient has a tumor that's really causing them some discomfort, they'll do palliative treatment options for this patient to help relieve the symptoms. How does chemotherapy work on the cells? As we talked about earlier, the cancer cells are very fast dividing quickly. So chemotherapy targets the cells in different phases of the cell cycle to allow for cell death and or damage. Just like that one slide, that little picture I showed you, there's different ways that can destroy the cell. A combination of different chemotherapies are needed at times to fully kill the cancer cell. Like as you saw from the previous picture, that some chemotherapy might stop the division of the DNA, others will actually destroy it or block it. So you may need different types of combinations to actually kill the cancer. Unfortunately, with chemotherapy, all cells are compromised. So this means that patients can be immunocompromised, their white cell count can drop down, so they're at higher risk for infection. This also can mean that their red cells can drop dramatically. This can cause shortness of breath, fatigue, and heart palpitations. There are times when patients will need blood transfusions to help them continue their chemotherapy. And another aspect is the platelets. This can destroy the platelets. And platelets are the cells that stop bleeding. So for instance, they might have a higher chance of bleeding. So if someone has a hemorrhoid, they want to be really careful with their bowels to make sure that there's no opening of that hemorrhoid and bleeding. Also, we recommend patients using a soft toothbrush because of their gums. So these are the type of chemo agents that you will see, the alkylating agents. This chemotherapy keeps the cell from reproducing by damaging the DNA. This is to treat lung, breast, ovarian, as well as leukemia, lymphoma, Hodgkin's disease, multiple myeloma, and sarcoma. In rare cases, this type of chemotherapy can lead to leukemia due to the effects on the bone marrow. So unfortunately, they do have a chance of getting leukemia just because of the chemo destroying some of the bone marrow itself. The chances are very low, but there's still a probability that that could happen. Nitroserous, this type of chemotherapy is able to go to the brain. So this reaches the brain barrier, and this is used for types of brain cancers and brain tumors. Antimetabolics, this stops the DNA from copying itself. It acts as a substitute for the building of the cells by blocking the RNA in the DNA. This prevents a cell from reproducing. These are usually used for leukemias, breast cancer, ovarian cancer, intestinal tract, as well as other cancers. Anti-tumor antibiotics, anthracyclines, they change the DNA inside the cancer cells to keep from growing. They bind with the DNA so it cannot copy itself and the cell cannot reproduce. These are used for several cancers. However, you have to use extreme caution with these types of chemotherapies because it can affect the heart. So usually with these patients, they'll have an echo prior to treatment. And also they keep track of the accumulation of the dose because there's only a certain limit that you can go to administering these chemotherapies. Otherwise, you can really destroy their heart. Topoisomerase inhibitors, I'm probably pronouncing that wrong, I apologize. These are plant alkaloids. They interfere with the enzyme, the topoisomerase. They separate the strands of DNA so they cannot be copied. There are different types of these inhibitors. There's a 1 and a 2, and they work in different ways. Meiotic inhibitors, these are also plant alkaloids. They stop the cells from dividing into new cells. These can cause nerve damage. There are two kinds of chemotherapies. They're the taxanes and the vinca alkaloids. Now, talking about nerve damage, these patients are at high risk for developing peripheral neuropathy, and that's numbness, tingling, or pain in the fingertips or toes or the hands. They can also get where the cold really affects them. A lot of times will have to wear gloves, hats, and socks on their feet. But this is something the provider would have to keep a close eye on because if the peripheral neuropathy gets too extreme where they're dropping things, there might be dose reduction and or stopping the treatment altogether. Corticosteroids, these are natural hormone and a hormone-like drug. Examples are prednisone, methylprednisolone, and Decadron. These are used for actual treatment to help break down the cancer, but it also can be used for anti-nausea. It works great with some of the anti-nausea medications to prevent the nausea. My reference is the American Cancer Society. This is a great resource. I recommend it for you guys to take a look at this. There's so much information on this site, not only for you, but for patients receiving chemotherapy. That's it.